Right now, we're looking at a highly critical and rapidly escalating situation unfolding in Central Africa. A new Ebola emergency is developing, and health authorities are absolutely sounding the alarm that this epidemic has entered a highly dangerous phase. We're going to break down exactly what's happening on the ground, the specific scientific threats involved, and what international health agencies are doing to respond. Okay, let's dive into this. Over 500. By May 19th and 20th of 2026, public health reporting showed an incredibly sharp escalation, with more than 500 suspected cases recorded. This isn't just some slow-moving, isolated cluster of infections. It's a staggering figure. It really indicates a fast-moving emergency that's demanding immediate global attention. Tragically, right alongside those suspected cases, we're seeing over 130 deaths across the Democratic Republic of the Congo and Uganda. Dozens of these are already laboratory confirmed. The virus is moving fast, and the human cost is literally rising daily. It's a number that truly anchors the severe gravity of this entire situation. To make sense of this chaotic crisis, here's our roadmap. We'll cover 1. A fast-moving emergency. 2. How we got here. 3. The Bundibugyo threat. 4. Challenges on the ground. And 5. What to watch next. Let's start with Part 1, a fast-moving emergency. Because of this incredibly rapid spread, the World Health Organization has actually declared the outbreak a public health emergency of international concern. Now, I know that sounds like a dense bureaucratic term, but what it actually means is severe. It's the WHO's absolute highest international outbreak alert. It sits just short of a full pandemic emergency declaration, so it's basically a massive red flag to the global community to mobilize resources instantly. And here's why that mobilization is absolutely vital. Public health agencies are warning that the official figures may still be behind reality. Because emergency surveillance really only recently intensified, many cases were probably missed early on. We're likely looking at weeks of silent transmission that are only just now becoming visible to doctors and laboratories through active case finding. Which brings us to Part 2, how we got here. Let's move to and see how this builds chronologically. In early May 2026, alarm bells rang in eastern DRC with a cluster of unexplained deaths and severe illnesses, which tragically included health workers. By May 15th, laboratory testing confirmed it, and the DRC formally declared an outbreak. Just 2 days later, the WHO declared a global emergency, followed instantly by Africa CDC declaring a continental emergency. From early May to over 500 cases by May 20th, this severe escalation happened in barely 2 weeks. Now, let's look at Part 3, the Bundibugyo threat. Most of our recent progress in fighting Ebola actually focuses on the familiar Zaire strain. And this brilliantly illustrates the core danger here. This outbreak is driven by the Bundibugyo virus. It's a rare species that's caused only a handful of recognized outbreaks in the past. And the terrifying reality is that currently there is absolutely no approved vaccine and no licensed targeted treatment for this specific strain. None. So without a vaccine, health workers are forced to fight this the hard way. They have to rely entirely on executing flawless, rapid response infection control. We're talking early detection, immediate isolation, supportive care, rigorous contact tracing, and safe burials. In a fast-moving outbreak like this, dropping the ball on even one of these 5 steps has fatal consequences. Moving right along to Part 4, challenges on the ground. Right now, at the epicenter in Ituri province, health workers are navigating an absolute minefield. They're dealing with regional insecurity and weak underlying health infrastructure. Add in constant population movement from the local mining industry and frequent cross-border travel, and, well, you have a perfect storm. These exact factors are what allowed the virus to slip into neighboring Uganda before full containment was even in place. So, the crucial point is this. Health agencies have repeatedly stressed that these rural hurdles create a very high regional risk.
If the virus uses these population movements to reach more densely populated urban settings or spreads even deeper into neighboring countries, this cluster is going to ignite into a vastly larger, unmanageable crisis.
Finally, part 5, what to watch next. Right now, a massive, coordinated global response is underway. The WHO issued its highest international alert. Africa CDC declared a public health emergency of continental security, and the US CDC activated its emergency guidance. On the ground, authorities are rapidly expanding border screening and cross-border tracing, while international partners rush in supplies and technical support. It's literally an absolute sprint to match the speed of the virus. Which leads us to the big question. Can this rapid spread actually be contained before it reaches more urban centers? The next few days are absolutely critical. If health teams can successfully detect new infections, isolate patients, and trace contacts quickly, containment is still possible. But if they can't, the risk of the virus spreading into new districts and cities grows exponentially. Make no mistake, this is not a contained event. It's a live emergency demanding immediate action. For the global health community, the mandate is simple. The response systems must move faster than the virus. Thank you so much for joining this explainer. Keep a very close eye on official updates in the days ahead.
Please like, share, and subscribe to Master Sense by Faraday, and turn on notifications so you don't miss new and upcoming videos. Drop a comment below and tell us what you'd like to see next.